Hi, today we're going to talk about brachycephalic breeds of dogs, and basically they are another word for saying flat-faced dogs. So they do include breeds like Pugs, French Bulldogs, and there's been quite a lot of talk of them recently, in media and in sort of social media, and why people are against them or why they're for them, because as you can see, they look very, very cute and very, very adorable, but they do come with their own health issues. And today we're going to explore a little bit more about those sort of issues that basically specifically affects these type of breeds. So, brachycephalic syndrome is a syndrome or a science or a clinical science that's described for flat-faced dogs like Pugs, French Bulldogs, anything with a flat face. Okay, well, so what happens is that why does this happen? Why does this occur? It is because when in a dog's anatomy, usually the normal size dog, they have a fairly lengthy nose. If you imagine that the nose has been squashed all the way much closer to the face or to the eyes, the tip of the nose much closer to the eyes, but the inside is still the same. Okay, it's still the same amount of sort of bone structure and soft tissue and things like that. So what happens is that if you try to squash, say a toilet, the end of the toilet roll, when you squash it, you'll find it crumples inside within the hole itself. Okay, this is essentially what's happening. So everything inside is convoluted, and with that comes to usually three clinical signs that can happen. The first one is the nostrils. They are very, very small. Okay, and that's not because the nostrils are small, it's because the flap outside is big. So when you look at the dog face front, you can see the very, very tiny slits that are nostrils, okay, and that can account for 70% of the airflow problem. Okay, the second thing is that they have got an elongated soft palate, because like I said, the whole face has been compressed short. Inside the mouth, the skin on top of the mouth, okay, both the hard palate and the soft palate, they're also pushed down closer to the throat. Okay, so the soft palate is now elongated, reaching into the throat itself, compared to a normal sized dog with a head that is a little bit more longer. Okay, and that soft palate that's elongated can sometimes catch on the the windpipe, so it blocks the air from going into the lungs. Okay, and that can be quite distressing. So together with the narrow airflow going into the nose, okay, and the skin flap that is blocking the airway into the lungs, you can almost imagine how difficult it is for little dogs like this to take air from the outside environment into the lungs. Okay, and sometimes what happens is they get very, very tiny airflow and can be quite traumatic. And sometimes with this, there are little saccules, little glands, little saccules at the top of the larynx or on the windpipe that gets inflamed, and they can sometimes be protruding. Okay, we call it inverted saccules. So together with the very, very narrow intake of the air and the elongated palate, the soft palate, and also the inverted saccules that now, because they are protruding out, they are obscuring even more of the airway that's going into the lungs. That is how these dogs, they struggle to breathe, and sometimes they can easily turn quite blue because they don't get enough oxygen. So if you can imagine breathing through a very, very narrow nostrils, okay, it is almost like sucking from a very, very narrow straw. It is not easy. It is really, really not easy. Okay, and for these dogs, sometimes they can cope. Okay, it depends. So they may grow out of it if they're very, very young, but the reality is that once they get to 1.5 years of age, if they still have these issues, they're unlikely to grow any bigger to alleviate those clinical signs. So that is where surgery is indicated. And usually surgery would minimally, depends on the airflow, or it depends on the nostrils, would involve some form of wedge resection of the nostril itself to actually open up the nostril to allow more air to go in when the dog takes a breath. Okay, and then they'll be done one on each nostril. Then after that, we will also shorten the elongated soft palate so that it doesn't catch over the windpipe. And last but not least, if there is everted saccus or inflamed saccus, as described before by the constant narrow airflow going into the lungs, we will remove those saccus as well. Okay, it can be quite a tricky op. Okay, and certainly it is one that requires bit of a sort of special equipment to be able to hold a dog in a certain position to be able to perform the surgery in a safe way while the dog is being anesthetized by the gaseous anesthesia. Okay, so that is and what we usually it is a day event. Okay, and we would send the patient home by check-in the next day. And for successful cases, which in my understanding it is pretty high, okay, the dogs are usually much happier, because once they can actually breathe in, most owners will describe they're much more playful, they're happier, they are not snorting as much, their breathing is so much easier, they're running more, they're exercising more, because they can actually get oxygen into the lungs. So that is a procedure whereby I would certainly be encouraging, especially if your brachycephalic dogs is showing clinical signs for that. And please do check with your vet of how bad is bad, how good is good, and whether they recommend surgery or not. If there's any questions, any comments, please post down below. If not, till the next video, goodbye.